We're going to talk about 17 causes of low libido. Number 1, pressure. Pressure, number 1 thing that comes up if the person's feeling pressured to have sex and is engaging in sex that they don't want to have over and over again, because everybody does it once or twice or, infrequently, but we do it. The more pressure they feel and the more they engage in sex that they don't want to have, the less they're going to want sex. So that's number 1, pressure. Number 2, gender. It is the case, and it's still very divided, that females have a responsive desire typically and men have a spontaneous desire typically. Of course, there are exceptions to this, and at least in my practice, it shows up pretty much regularly that way. So gender is a big one. Gender will affect your sexual desire, how it presents itself, how much you want it, and what it's affected by it. Number 3, emotional wounding. Emotional wounding affects sexual desire because if you're wounded, whether it's because of something that's happened to you in the past or something that's happening to you now, for the people with responsive desire, it's going to affect their desire. It's just going to lower it. Number 4, power dynamics. Yes, if there's a power dynamic where one person feels inferior or less competent than the other, and especially if there's an overfunctioning and underfunctioning dynamic where one person's the parent and the other person's the child, no one wants to have sex with their parent and no one wants to have sex with their child. So that has to be addressed. Conflictual relationship. Responsive desire, most women are not going to feel sexy if there's conflict in the relationship. If there's conflict in the relationship and the person with the responsive desire is not feeling connected, that's not feeling emotionally safe, they're not going to want to have sex. Trauma affects everything, including sexuality. So if there's some trauma, whether it's due to the relationship, it doesn't have to be a big trauma, but it could be something that's significant enough to be called trauma because it has long-term effects. So yeah, if there's any type of big wounding trauma in the past or in the present, again, not a place where somebody's going to want to have sex. Number 7, infidelity. Oh yeah, that is a tough one because at the beginning it might be that the person has more sex than they did before because in some way they have to prove like, I'm as good as the other person that you cheated on me with. I'm better than they are. Like what's going on? And so they go to work proving, especially sexually, their value as a sexual human being. And they engage in a lot of sex. There's even a term for it. I don't remember what it is. So that it affects it positively in whoever is more desirous, but it is also affected negatively because after that period of time, then the anxiety, the hypervigilance, all the traumatic markers show up when a person doesn't feel safe and cannot trust the other person. Is when they have responsive desire, they're not going to want to have sex either. Differentiation. Esther Perel wrote a whole book on that relationship needs space in order to have fire. And that makes a lot of sense. I've seen a lot of people that are just too close, whether it's emotionally too close or physically too close. So there were some sexual issues because when there's no space and there's no mystery or unavailability or like some separation where you can see that person beyond who they are in this day to day, again, not a very sexy place to be. Performance anxiety. If you have anxiety around performance, whether it's that you come too quickly or you are not able to get erect or maintain an erection, or you're not able to orgasm. All those are what we call like performance. And so the anxiety around that will definitely reduce your sexual desire. Nobody wants to go to a place that they feel they don't do well in. Body image is a huge one because, we use our bodies for sex. So it's pretty important how we feel about it. And if we don't feel good about it, we're not going to want to take our clothes off and just, be like disinhibited and free. It's just not going to happen that way. Number 11, social expectations. Now, I went through in detail in the video on sexual desire on this, but I'll just be brief. Social discourses about what is the ideal amount of sex or kind of sex that you should have. You would think it would affect sexual desire in a positive way, but what it does is it's a negative way because people can't reach these ideals. They feel shame, and shame stops you from everything. So not the best. If you're going to have societal ideals and expectations, then at least let's have them be a little bit more reasonable. Shame, just like I just said, whether it's shame that you can't do this thing right, or shame that you have given yourself up for whatever, or shame that your partner cheated on you and you're still there. All kinds of different ways that you can feel shame. And just think, like, when you're feeling shame, you're not feeling sexy. Except for there are some people that when they're feeling all these things, negative things, sex makes them feel better. And that's a whole nother story of like when we use sex in order to soothe ourselves. But usually when we're feeling shame or any other of those really intense, distressing feelings, we're not going to want to go and have sex. If we're depressed, if we're anxious, no, it's not going to happen. We can't even think about taking a shower, much less having sex. And when you're anxious, you can't do anything. You're just like, ugh. And so, yeah, those are not the sexiest places. Pain during sex, again, makes sense. If you're having pain during sex, you're not going to want to go in and have more pain. Your body is going to fight you every inch of the way. It does not want to experience pain, and so it's not going to want to have sex. Number 15, addiction. Whether it's sexual addiction or any other addiction, when a person is an addict, they can't have a real relationship with you. Their primary relationship is to their drug or choice. You're kind of like the mistress in a way. So you're always kind of in second place. You're definitely not an emotionally connected, safe, and nurturing relationship. That's not the situation that goes on. If there's an addiction, things are pretty ugly, pretty conflictual, pretty disconnected. So definitely not a sexy place. Lifestyle comes up probably up there. That's the whole reason why the whole pressure thing starts. If you're tired, if you're anxious about money, if you're overworked and not compensated well, if you have kids, if you have more than 2 kids, if 1 kid, or you have too many kids and you don't have enough resources, or you don't have enough help, you don't have family around, you have to do it all yourself. You become tired and stressed, and then you have to go do housework and cleaning and cooking and all of that. Definitely not sexy, especially for people with responsive desire. Finally, number 17, which is the sad one, is just a loss of attraction, or maybe the attraction was never there. And that's the scariest place, I think, for people to go to, for both people, for the person that's going to feel the rejection and for the person that has to do the rejection. It's both a very difficult place to be able to say, I'm not attracted to you anymore, or I've never been attracted to you. And it's pretty devastating, but I would think it would be good for both people to hear this, because you're kind of saying it anyway, and that person is experiencing anyway. So why not, if you're sure, bring it up as that. Sometimes saying a hard thing will liberate another person, because now all the moments that they knew that to be true, they're thinking they're crazy. And you saying, it's true what you've been saying, I'm not attracted to you. Yeah, it hurts, but it's also a relief. Oh my God, I'm not crazy. So definitely something to think about, whether you can actually be sure and talk about where you're at as far as this attraction. And if you're ever in a situation where a person's not attracted to you, although it's a difficult thing, it does challenge you to think about your value system and why this particular thing can determine whether you feel good about yourself or not. So much so that your cognitive abilities to be able to see the logic and that not everybody's going to be attracted to you, it still feels like when people are not, it's the end of the world. And so it's this ego and value system that we engage in, that being the most desirable person is the way that we're valuable, that we're alive, that we're, doing it. So challenging those systems and coming face to face with, I think the quickest way to change those type of identity structures is just to be okay with whatever it is that you fear you are, that you could be. So being okay with not being sexually desired. So what? I'm not sexually desired. So what? I'm a below average lover. Oh my God. When I suggest these things to people, they look at me like I'm crazy, because that's the power of this whole thing.